This is not medical advice. Nurse John here. Just wanted to talk a little bit about blood gases for a minute. We're mostly concerned about carbon dioxide and oxygen as far as gases. Let's look at interpreting blood gas lab results. Question: how is the oxygenation? Low arterial oxygenation could be from hypoventilation, lung conditions impairing movement of oxygen into the blood, such as pneumonia, COPD, pulmonary embolism, ventilator settings in the intubated patient, and oxygen therapy, just to name a few. Low venous oxygen may indicate low cardiac output, increased oxygen demand, anemia, or poor initial arterial blood oxygenation. Next, let's look at pH. Personally, I use the terms acid and base because initially it helped me to remember acid comes before base alphabetically, and acid comes before base on the 1 to 14 pH scale. Even small pH shifts can affect enzyme functioning and oxygen binding. Next, let's look at CO2 and bicarb to see if we have respiratory, metabolic, or both factors impacting pH. Let's look at acidosis and alkalosis on blood gas tests. The body can be in acidosis because of retention of CO2, respiratory, or loss of bicarbonate, metabolic. Likewise, the body can be in alkalosis because of loss of CO2, respiratory, or buildup of bicarbonate, metabolic. It's worth noting that some labs also report base excess, which really quantifies metabolic alkalosis or acidosis, essentially measuring the degree. So a large negative base excess indicates metabolic acidosis, while a large positive base excess indicates metabolic alkalosis. So the number of results on a blood gas is really pretty limited. You have acidosis or alkalosis. Is the acidosis or alkalosis uncompensated, partially compensated, or compensated? So let's look at a couple of examples. So if we look at the pH, it's on the very low edge of normal, indicating an acidosis condition. The CO2 is elevated. The bicarbonate is elevated. The partial pressure of oxygen is reduced. And since CO2 is the acidic component and the respiratory marker, we know that we have respiratory acidosis. You can also see that the HCO3 is elevated, and that's the metabolic marker. So what we have here is we have the metabolic marker compensating for the respiratory acidosis. So we have fully compensated respiratory acidosis. Okay, here we have an example of a blood gas in septic shock. Clearly an acidic condition. We have both the respiratory marker and the metabolic marker being abnormal, and the oxygenation being abnormal. So what we appear to have here is some tachypnea. The patient is blowing off CO2. CO2 is low, which should be helping to improve the acidic condition. But it looks like we have cardiac output issues and some organ dysfunction with the kidneys losing bicarbonate. We have substantially low bicarbonate with some degree of respiratory compensation, but it's not able to bring the pH back to normal level. So we have partially compensated metabolic acidosis. Look first at the pH, respiratory or metabolic conditions, or both. And then finally, we look and see if the body is compensating. So the pH tells us what's happening, and the carbon dioxide and the bicarbonate tell us why. If you found this helpful, appreciate it if you'd like it and subscribe it and share it. That helps out tremendously, and hopefully that's not too much of a bother. Thanks. Bye-bye.